What's up, everybody? It's Dr. B. We're going to take a look at the skull next. We're going to take the skull and break it up into different views instead of having one long skull video. We're going to do the anterior view of the skull first, then we'll switch to do the lateral views. We'll talk about the superior view at that time. We'll then flip the skull over, we'll remove the mandible, and we'll take a look at the inferior view of the skull, and then we'll take the top off the skull and do a sagittal section of the skull. So I'll have a different video for each one of these views. Now, we're going to be identifying both bones and structures here as we go through the skull. There's going to be a lot to it. I'm going to try to remember everything that's in the lab manual. Hopefully I don't miss any of the structures off the top of my head, but we're gonna get through as many of these things as we can. So the first thing we're going to do is identify the easiest bone, what I consider to be the easiest bone on the skull, and that is going to be the frontal bone, okay, which is one of our cranial bones. The frontal bone has a small protrusion right in this area right here that we call the frontal squama. Okay, basically that's your forehead or the ridge associated with your forehead. We can see the eye orbitals, all right? At the superior part of the eye orbital right here, we have a ridge of bone that we refer to as a margin. And because of where it's located above the eye orbit, we name it the supraorbital margin. All right, so that's this ridge of bone right here. In the supraorbital margin, you can see that we have a foramen in each of our supraorbital margins, right there and right there. That is the supraorbital foramen. Just inferior to the eye orbit, you can see we have another opening right there. Those would be the infraorbital foramen. If we look at the back of the eye orbit, okay, all the way into the eye itself, you can see that we have the superior orbital fissure. All right, we'll see the superior orbital fissure again when we do the superior section of the skull, but you can see this superior orbital fissure at the back of the eye orbit right there. That's going to sit basically at the inferior part of the sphenoid bone, which we'll identify multiple times here today. If we look into the nasal cavity here, we have two bones. One bone is this inferior part of the nasal septum right there. That is the vomer. And then superiorly making the nasal septum right here, the top half of the nasal septum basically, that is going to be the perpendicular plate. Now the perpendicular plate is part of the ethmoid bone, and the ethmoid bone we'll see again when we do the inferior section of the skull. We can also see the ethmoid bone here in the eye orbit, okay, right here and right here. Okay, those are the lateral aspects of the ethmoid bone, which basically is going to fit almost like a sword going down through the frontal part of the skull. Now, in the nasal cavity, we also see some concha. Right, these concha bones are going to be protruding out towards the medial aspect of the nasal cavity. These are the inferior nasal concha. And these up here, a little bit harder to see, those would be the middle nasal concha. There is a set of superior nasal concha, but they're much higher up. Bones, some of the facial bones that we find right here, we have most of these in pairs. The first paired bones that we'll talk about are the maxilla. Okay, the maxillary bones are going to be right here. Those are our upper jaw bones. Next to the maxilla, right in the corner of the eye orbit itself, right there, that would be the lacrimal bone. And in our lacrimal bone, right here, we have the lacrimal fossa. All right, so you can see this opening right there in the lacrimal bone. That is the lacrimal fossa. You can see the maxilla is going to come up all the way here, and it's actually going to articulate itself with the frontal bone. Now we have a pair of nasal bones. Okay, these would be our two nasal bones right here at the top bridge of the nose. As we move down and look at the lower jaw, okay, the lower jaw bone is all one solid piece of bone, and that is the mandible. All right. We're going to disarticulate the mandible in just a minute, and we will look at some of the other structures that we're going to find on the mandible. Some of the structures we can see right here, though, on the mandible, two structures, two openings, one here and one right here. Those are the mental foramen, all right, mental foramen. The mental foramen, the infraorbital foramen and the supraorbital foramen are all related to the three nerves for cranial nerve 5, which we'll do when we get to the nervous system, and that would be the trigeminal nerve. Okay, those are openings that are representative of that nerve. Lateral to our maxilla, okay, right here, lateral to the maxilla, our cheekbone, which is going to make the lateral portion also of the eye orbit. That is our zygomatic bone. All right, so we have two zygomatic bones, one on each side. And you can see these little suture lines here separating the bones out. So when you're looking at the skull and you see those suture joints, you know that's where one bone ends and another bone begins. When we look at the teeth, you can see the teeth are set into our two maxillary bones here and our mandible down here. And you can see these ridges that are created by the sockets for the teeth, okay? These little protrusions that we see along here, those are called the alveolar processes, okay? So those are all the little bumps that we see running along the surface of the upper and the lower jaw. These would be the alveolar processes of the maxilla. These would be the alveolar processes of the mandible. So I think that about wraps it up for our anterior view right here. We're gonna pause this video, start a new video, and take a look at the lateral view.